is one of the most popular methods of smoothing frown lines, forehead wrinkles, and other fine lines on the face. Botox treatments are an FDA-approved method of achieving smoother, younger-looking skin. Chanel Brogdon from AOMS is here with an easy and affordable way to achieve a refreshed look. Okay, so we're just talking about Botox. Kind of tell us what exactly it is and how it works.
So Botox is a neurotoxin that stops the nerve from telling the muscle to contract. So whatever area on the face we're wanting to treat that's causing lines bothering a patient, then we can block that muscle from contracting and causing those lines on the face.
Okay, so when do we start it?
So I tell my patients to start whenever they start noticing the lines that are bothering them, and even though they're using moisturizers and creams, that's not always doing the trick. The only thing that stops the muscle from moving is Botox. So if there's a line that bothers you, or if a certain expression bothers you, like when you're sitting there having a conversation with someone and they're constantly glaring at you, frowning, then, and that bothers you and you can't seem to stop it, then we can stop it with Botox.
Okay, so my question to you is, though, once you start it, you got to kind of continue to do it, right? Because it does kind of wear off.
It does wear off, and it lasts 3 to 6 months, but most patients that want to maintain that same smooth appearance normally come back every 4 months. But if someone wants to do it once a year, just so those lines don't get deeper and deeper over time, you don't have to do it on a set schedule. You can do it once a year or however often you feel necessary.
Is there a point where it's too late to do it, that Botox won't make an impact?
There is. If I get 60 or 70-year-olds that come in, yes, your face might be too far gone.
Right.
But most muscles can be helped, but it just might take a little bit longer to get the desired results once those lines are so deep.
Got it.
Most people with normal lines, 20s to 40s, those are easily erased in a matter of weeks once the Botox kicks in.
And it's something that sort of like stops that progression, so that's
Correct.
really nice.
Yes.
Okay, let's talk about budget, though. I mean, if this is something you're doing on the regular, it can kind of get pricey, but initially it is a lot more affordable than what I thought it was.
Correct, especially if someone comes in, yes, to treat your whole face, you're looking at sometimes upward $500. But if someone comes in and they're like, well, it's just my crow's feet that bother me, and they want to stay under $150, that's easily achievable. You could do easily 12 units for the crow's feet, which we're at $11 a unit, or I am. And so that would be $132 to not have wrinkles when you smile. So,
I mean, that seems like it's something, if that's something that really concerns you, that's something to spend $130 on, you know what I mean?
Yes.
Okay, how about downtime afterwards? That's pretty non-existent, right?
You can do it on your lunch break and go back to work, yeah. You just don't want to do anything strenuous for 3 hours, like exercising, heavy lifting, or massage the areas where we inject, because it's still doing its job for those 3 hours, so we want it to stay where we place it.
Makes a lot of sense. Okay, where do we get an appointment going? How do we make this happen?
Call AOMS, of course, at 353-1055 and set up an appointment with me, Nurse Chanel, and we can do a consult and then injections that same day, as long as there's no contraindications like blood thinners or something like that. And we can do the appointment that day, 15 minutes in and out and back to work.
Easy peasy.
Yes.
All right. Well, good information today. A lot of people have questions about it, so you answered a lot of them for me for sure. All right. Thank you. Stick around, everybody. The Amarillo